So Invisalign is probably the coolest thing that we do in the office. There really isn't a patient that we have seen, save for maybe 2, that can't have Invisalign. People who are really interested in it have looked into it, and somebody along the way has told them, oh, you're not a candidate. You can't have Invisalign. It won't work for you. But nowadays, we're on the 6th generation, I think, of Invisalign, and we've done just about anything you can do with orthodontics. So as far as candidacy, we've had a patient as young as 9. She'd lost all her baby teeth early, and the oldest patient we started on was 78. So there's your age range, 9 to 78, and it will fix a lot of things. You know, if you don't like the way they look because they're crooked, that's great. You know, we can straighten them out. If you're missing teeth and you don't want to go through the expense or the surgery of an implant, we can pull the teeth together. If you have periodontal bone loss or you have gum disease, a lot of times moving the teeth once that disease has been treated will actually help bring a little bit of the bone back, because as you move the teeth through the bone, you actually stimulate bone growth a little bit, and you can fix that problem in a sense that maybe it's the crowding that was making it difficult for you to keep your teeth clean. So once the teeth are straighter, they'll be easier to clean for you, they'll be easier to clean for us. And most patients, I would say 90-95% of patients, once they're done, they come back and say, man, flossing's easy now. I don't mind flossing now. Or, you know, I'm able to get everything off. My breath isn't as bad. You know, we hear it all after Invisalign. And the other great thing that it does is it helps with your jaw joint. So if you're somebody who's had jaw pain or problems, maybe you have some clicking or popping, your jaw gets tired easily, it could be due to the way your teeth are sitting in your mouth. You know, if they're leaned over towards your tongue, if you're not sitting in the ideal position for your jaw, a lot of times you'll have some jaw issues. And so the Invisalign itself will help kind of correct some of that. We had a lady just the other day who had been having jaw pains and headaches pretty much her whole life, and her teeth were really folded over to where she didn't have a lot of room down by her tongue, and so her bite was kind of collapsed a little bit. And because the aligners sit on top of the tooth, and there's about 1.5 millimeters of thickness of aligner on top and bottom, it immediately put her in a 2 millimeter difference as far as where her rest position was. She came back and told me after 4 weeks of wearing them, she didn't have headaches anymore, she didn't have any jaw pain, and you know, her teeth, she's not done, but it's one of those things where we've done 10 just for jaw joint issues, and all 10 of them have said within a few weeks my jaw felt rested, it felt better, didn't have the clicking or popping, I didn't have pain anymore. And so there's this large variety of things that Invisalign can help with.